Good morning, everyone. Welcome to the Thursday, January 20th, 2022, first meeting of the year, Joint Boards of Health and Hospitals meeting for the City of St. Louis Health Department. And I'm glad to see everyone is healthy and well, and I hope everything is going well. I would like to call the meeting to order at this. And our first order of business is the approval of the Zoom video from December 16th, 2021 from last year to serve as our minutes from our last board meeting. So may I please have a motion to approve that Zoom video to serve as our minutes from the December 16th, 2021 video.
Move approval.
Thank you. A second, please.
Second.
All opposed? Any abstentions or objections? All right, so moved. And I will, before we head into our first major agenda item, which is COVID-19 testing, I think that we've moved our board members over. I wanted to welcome our two new board members. Were we able to move them over to the?
We are still efforting that. Ms. McNichols is joining us on attendees. I'm working on getting her into the panel.
Okay, we will take a pause after perhaps the COVID vaccine update or during the, we could actually take a pause and do that during the governance committee and nominating report. Linda, if that's fine with you. So the next agenda item will be COVID-19 updates, data testing and vaccine distribution.
Perfect.
Good morning, everyone. Can you hear me?
Yes, we can. Thank you.
Great. So I will be providing COVID-19 updates. This is data as of January 17th, vaccination data as of January 14th. So this first slide will be looking at national hotspots. And as you can see here, we're going to be comparing the national sort of landscape from the 2nd, the 9th, and the 17th. And what you can see here is that cases have been rapidly increasing nationally, with a 62% increase in cases over the last 14 days, as evidenced by the sort of increasing density of color across these maps. The amount of transmission is unprecedented and is causing serious strain on the healthcare system across the US. This next slide is looking at variants of concern. And here you are looking at the different variants of concern as classified by the CDC. And on the left, you're looking at this for the United States. On the right, for our region, CDC region 7. Omicron very quickly replaced Delta as the dominant strain across the US, representing an estimated 99.5% of cases. Locally, Delta has also largely been replaced by Omicron, as you can see on the right, with roughly 97.8% of cases in CDC's Region 7, which, like I said, does include Missouri. So here we are now looking at Missouri State sewershed COVID-19 cases and fragments in sewers through January 9th of this year. So viral fragments found in wastewater correlate strongly with COVID-19 case counts. This is another way that we are able to keep up with surveillance in this regard. And so this is making sewershed surveillance a helpful tool to estimate how much virus is actually circulating in the community. The purple band represents the number of RNA fragments in samples collected at sewershed surveillance sites, and the blue bars represent the number of COVID-19 cases across the state of Missouri. So you can see here that since January, since the end of December, there has been a stark increase in those fragments and in those that represent viral copies. So here we are looking at the St. Louis City COVID-19 epidemic curve. And the 7-day case count average seems to have plateaued over the past week. The peak of this wave, 507 cases per day, was more than 3 times as high, the second highest peak last winter. So while I use the word plateau, I don't want people to get a false sense of security, because these are still incredibly high numbers compared to where we were last year. And of course, concerning because we have a lot more tools at our disposal, highest of which are vaccinations. The Omicron variant has swept through the nation at such a fast pace that it may have already reached a critical point where the population of susceptible hosts has been depleted. A sharp rise and fall pattern has been seen elsewhere, and we may be on the downhill side of this slope. So here we are looking at COVID-19 cases and rates per 100,000 by census tract. So mapping cases and case rates by census tract provides a more granular view of transmission than zip codes. We can see that the case counts and rates are elevated across the city, indicating widespread community transmission. Most of the census tracts with the highest raw case counts are located in the south. So if you look at the map on the left, you can see that there. However, when you adjust for population size, which is the map on the right, we can see that the highest rates are predominantly in census tracts north of Delmar, in neighborhoods like Kingsway, Vandeventer, and Jeff Vanderloo. Below Delmar, Forest Park Southeast, the Hill also had very high case rates. So this is looking at COVID-19 case density by ward and neighborhood, and transmission has increased generally across the city, with several bright hotspots that can be seen in densely populated area. Southeast neighborhoods continue to have the highest density, but 2 notable hotspots can also be seen in the Central West End and Kings Highway neighborhoods. One hotspot is associated with an outbreak in a congregate living facility, unfortunately. So this next slide is looking at COVID-19 testing volume and results. The number of tests being performed each day has increased over the last 2 months, with a peak of over 3,500 combined PCR and antigen tests performed in recent days. I will be talking about a strong initiative that the city took the lead on in the region that we attribute to this, where in response to our hospitals being overwhelmed and hospital CEOs coming to me and saying, basically, we are having people come to our emergency rooms looking for tests, and this is making us unable to respond to the very ill. So what we have done at the City of St. Louis is, as of last week, we increased the capacity to test within the city by up to 2,000 tests daily. And you can see how that has dramatically increased the testing volume within the city. And I'm very happy to report that when I met with the same hospital executives on Tuesday, they noted that this has had a dramatic decrease in that type of volume that was coming to the emergency room. So really wonderful to see the city take the lead here in being in a robust response at this critical time. I'll talk a little bit about other initiatives that we have to help the region. So this is the COVID-19 percent positivity rate, looking at PCRs. So percent positivity is still extremely high at roughly 30%, but similar to case counts, percent positivity has recently plateaued and begun to decrease. And while this is encouraging, we still have a long way to go, because again, these numbers are too high to not cause severe morbidity and potentially mortality within our region. I'm going to skip this in the interest of time. Our COVID-19 case demographics by race, we continue to see that African Americans are disproportionately affected by COVID-19 throughout the course of the pandemic, and an outsized share of cases so far in 2022 compared to Caucasians. For age, so far in January, the proportion of cases aged less than 10 has increased compared to December, as has the proportion of cases above 60. This is not a reassuring statistic. These are our most vulnerable, right? The youngest amongst us and the oldest amongst us. The highly infectious Omicron variant may be evading immunity in this older age group, which is a high vaccination rate. Booster doses are critically important to protect seniors in our community from severe morbidity and mortality. And so if we're looking for messaging here, really getting people vaccinated and boosted is critically important to relay at this time. So here we're looking at pediatric percent positivity and testing rates. These colored lines show the 7-day rolling average of percent positivity for ages 0 to 19 in 5-year age groups. The blue bars represent the number of tests performed per 100,000 each day, and the data for each group is shown on the same scale to allow for direct comparison for both percent positivity and the number of tests. So percent positivity has risen sharply across all pediatric age groups, but seems to have plateaued in recent days. The testing rate amongst children has doubled over the last 2 months, coinciding with the Omicron wave. If we look at the vaccination initiation pediatric population, currently 43.5% of eligible school-age children have received at least 1 dose. Children living on the north side, predominantly African-American, have very low vaccination rates compared to the highly vaccinated southern zip codes, and are therefore more likely to suffer from secondary consequences of COVID exposure and infections, like time lost to learning. So this is very concerning for us. We continue to have a pediatric work group that will be meeting on Tuesday, and we'll be discussing strategies. But we're also happy to report that the city now has doses of pediatric vaccines, and I'll report in my departmental updates later as to when we'll be rolling those out and some of our strategies around this and equity. And looking at new and current COVID-19 hospitalizations, the number of new and current hospitalized patients in the Pandemic Task Force regional hospitals rose to record levels in January, as I alluded to earlier. Fortunately, in recent days, the number of new hospitalization has stopped breaking records, but the inpatient census remains critically high, and hospitalizations tend to lag behind case counts. So hospitalizations are expected to remain high for the next several weeks. Really supporting our hospitals and healthcare workers has to be the goal and our primary concern, alongside vaccination and boosting and equity initiatives, given the disproportionate impact in African-American communities, specifically in children. So I'm happy to report a new partnership with Dr. Alvin Gang at Washington University to provide us some additional data. So Dr. Gang and colleagues developed the Lima model, which is used to predict the number of hospitalizations from COVID based on how many have been observed. So if you look at this graph on the left, the red X's on the graphs and other underlying assumptions like vaccination rate and variant severity are taken into account. So the figure on the left shows hospitalization predictions, which assume either a low, medium, or high level of prior infection in the community. So we're able to kind of look at how we expect this to go for these 3 different scenarios. More prior infections would mean the susceptible population is smaller, resulting in fewer cases and hospitalizations. The figure on the right shows predictions where the effective reproductive number is decreased by some event or intervention. These hypothetical interventions may include things like residents being more stringent about preventative measures, new policies like mask mandates, or gathering restrictions, or a sudden increase in vaccination. Both graphs predict a peak in mid to late January with a sharp drop heading into March, but the peak of the hospitalization curve has not been reached in these scenarios, and our hospitals are already strained. So you can expect that model to maybe shift more to the right if that scenario continues. So I think we're trying to use this to sort of give people an indication of what interventions may be helpful and also what to prepare for. And that has been informing the city's approach, which again, I will speak to you about a little later. Here we're looking at vaccination rates, so initiated, completed, and boosted. Zip codes in, So the number of first, second, and third doses has increased in recent weeks, but then leveled out again. St. Louis City is now 59.3 fully vaccinated in the eligible population. So that's ages 5 and above. And 1 in 5 residents have received a booster dose. Encouraging, but still a long way to go. This shows vaccination initiation of ages 5+ by geography. So zip codes in the north of St. Louis continue to lag behind the Southwest zip codes in overall vaccination, but have generally had faster rates of change in recent weeks, which we're very proud of because there have been really targeted strategies around partnering with trusted messengers in those zip codes, like at churches. I was at one of our missionary Baptist partners over the weekend, and it makes a difference, right? It decreases a lot of the social barriers to getting to these. This was on a big snow day. A lot of folks in the neighborhood were able to walk, but overwhelmingly, most of these people don't come because of DOH or me. They come because of their pastor. They come because of their trusted leaders in the neighborhood. And what was also encouraging was to see people drive 30 minutes out to come to the north side. Also, so that folks who have cars, they should be the ones who are making those journeys, but we're taking vaccines to folks most in need. And that's evidenced here. We're looking at these neighborhood vaccination clinic, and these small neighborhood clinics to bring the vaccine to where people live are really highlighted on these maps here, where the purple pins on the map show DOH-sponsored clinics so far in the month of January. In addition, we've been working with vaccinator partners like FQHCs and school districts to administer vaccines. And just in these two partners alone, that has accounted for an additional 1,700 vaccines being administered. So I'll stop here and I'll take any questions.
Thank you, Dr. Mahdi. Do we have any questions
I
from
have a question.
panelists?
I have a question.
Dr. Sangeefer, go ahead, please.
Yes. So how do we account for the number of people who get COVID but never report it to anyone and just
Yeah, this is a national issue, and it's such an excellent question. I'm in conversations with FQHC CMOs and other healthcare providers, especially with antigen tests on the market now. We know that we are grossly underreporting. There is no system that the government or the CDC has put in place for us to be able to report those tests, although guidance has been given by the CDC on how to do it. And that's really difficult, right? Giving people clear guidance on how to use a test for which a reporting strategy has not been, nationally made or approved, or even giving us guidance on how to do that is very challenging. So I meet with a lot of the regional directors, health directors, as well as in conversations with the CDC, and we're advocating for this, but it doesn't exist. So what we do at the city is we still recommend PCR to be the gold standard for diagnostics. The utility for antigen tests, at least by our updated policies, is for the isolation and quarantine period, because it's not a perfect measure, but can be a measure of infectivity, which is better than nothing, especially since the isolation and quarantine guidance has been dramatically decreased in the last weeks. So an excellent question for which there is no national standard, and should make us all alarmed that there could be underreporting of cases. I see Dr. Ross, and then I see Susan and Dr. McBride as well.
I'll have Tim and Susan go first. I was after them.
Sorry, Susan.
Thank you. Yeah, just two questions, actually. My first question, and I'm really glad that we are focusing on the pediatric population as well, but the other population that at least I've been on calls with federal partners about in the past several weeks has been really focusing on getting pregnant women vaccinated as well, because we know that those who aren't vaccinated are, the people who tend to be in our ICUs and having poorer outcomes. And I'm wondering if we have any messaging targeting that population. And my other question, and this was just an observation, honestly, that I had never thought about, but at testing sites, when there are no tests available and people are coming in that are clearly sick and probably have compromised respiratory issues, is there any messaging to them about where to go and what to do when they are so symptomatic, other than just trying to find a test?
Right. So excellent question, Susan. Let me address the first. So pregnant women is, it's such an important group. I did some counseling over the weekend with a pregnant woman who was more fearful of the risks that the vaccine would have than COVID itself, right? And we know that in the last 2 weeks, data has come out very clearly talking about the very significant risks to pregnant women that includes stillbirths and a lot of other really, really significant side effects. We know that this data is much more robust now than it was a year ago. So I agree with you that it's important for us to have directed messaging, and can certainly work with my team. I took a meeting with Planned Parenthood over the weekend, just over a week ago, and their communications team is now working with our communications team to help with pointed messaging, of which this will be at the top of that as well, in addition to other collaborative messaging that we're trying to work on together. So couldn't agree with you more. I do know that when we speak to our hospital partners, there are strong pushes within the hospital system to make sure the pregnant women are not only counseled, but are given, unfortunately, some of the precedents for very little new therapies. The Paxlovid, as you know, was recently approved as a therapy, but has been given in very limited supply. So in many hospital settings, this has been prioritized for pregnant women. So to your second question, and quickly remind me, Susan.
My second question.
Rooms. Yeah. So
it
people
was
who are coming for testing is their messaging. So when I meet with, so in response, I alluded to this earlier, in response to the overwhelming number of, we had testing shortages across the region, but also what was happening in emergency rooms. I had found a new vendor for testing our city employees, Nomi Health, who had done just a superior job of really making sure that we had high quality testing. And by that, I mean, low wait times and rapid turnaround. Because as many of you know, there was beginning to become a national issue around, sure, people going to get PCR tests, but then results being delayed by 3, 4, sometimes 5 days, even up to a week. So this vendor had reliably been getting results back in under 72 hours, and wait times are 20 minutes or less. So I approached them about expanding that contract and was able to find emergency funds to do so. And we now have 2 new locations, one actually at the Department of Health, 1520 Market Street for the general public. And we will be announcing 2 new locations, and I'm hoping 3 by tomorrow, if not early next week, in South City, where there is much lower representation. Whenever I meet with those people, I talk to them about a lot of things that have to be implemented for the safety of the public. And one of those is, again, if people come that are obviously sick, being able to direct them to appropriate help and care at emergency rooms. So in the city, that is happening. I meet monthly with the county, and that has been going well. And we'll definitely bring both of your thoughts, your considerations to the table there too. Dr. McBride and then Dr. Ross.
Yeah, thank you for the excellent presentation and the hard work of the city department health staff and all the health providers on here. I know you're working extraordinarily hard, so I appreciate all that. The slides were pretty alarming and scary in many ways, but the one that really, the one I want to ask about that really struck me was the difference in the vaccination rates between pediatric populations on the south side and the north side. It's like 80 or 90% versus 20. Mm-hmm. And, if you could speak, it seems like that's a real thing that we need to message around, and, what we can do about that. That's really alarming. Yeah,
it's very alarming. And, national standards and what we've been trying to do and doing consistently is trying to reach out to partners. And the biggest partners that we have here are our Board of Aldermen, coming to them consistently and saying, if you have locations, if you have partnerships that we can partner, we're happy to come and partner with you. Schools as well. And unfortunately, there is a disparity there that we're aware of. And then with our FQHCs as well, who have been doing a phenomenal job. You saw the numbers there for Maffinia and Care STL. So that is where we have to go. But we also have to know that that must speak to a lack of trust here for parents and caregivers around this. So it's about education. We unfortunately had a town hall for youth planned for January, but then the surge happened. And for that population, it's critically important to do something that sort of caters to them. And so there was an in-person component that was planned. We've had to move that, and worst case scenario, do it virtually. But if you've ever done these, I do these a lot for the community. And doing something like that has children on Zoom is an impossibility. Any parent on this call will tell you that trying to get kids on a Zoom to engage, to really understand what's going on can be really, really difficult. So we're having to take a step back. And on the call today is Franda Thomas, who oversees our CD and Women, Children, and Adolescent Health. Her team are also here, Candace De Silva, Valerie Newborn, and Suzanne Alexander. They have been working tirelessly over the last couple of months and really throughout the pandemic to really sort of increase messaging amongst women and in schools particularly. So what we've done here is we've increased our listserv, and Suzanne Alexander has increased our communication bank to be able to reach out to early childhood development centers, as well as to principals across school districts. We've been sending them a lot of information, support, letting them know that we're available. She and her and myself have actually made ourselves available to meet with them to help with messaging. So it has to be a dual approach, messaging, but also finding trusted messengers within these communities to be able to provide those vaccines. My hope is now that we have pediatric doses available, which the city did not have until this time, that we will now be able to do more around vaccination events that are just wraparound. Anyone above the age of 5, first dose, second dose, or boosters, Medicaid Expansion, which we're partnering with the Regional Health Commission and Missouri Foundation for Health, and gift card incentives, which we only had the capacity to give for first doses, but we are now expanding to first dose, second dose, and boosters. So being able to provide people with the support they need to come out and get these vaccines, I think will make a big difference, because our vaccine incentive program has been really well received. But I'm happy to take other suggestions from folks about how we could be addressing this in a more robust fashion. Does that help, Dr. McBride?
Absolutely, it's pretty thorough. You're doing what you can, I think so.
Dr. Ross and then Linda.
Yeah, a real quick question, Dr. Maddie, and that is the use of mobile vans to deploy both testing as well as vaccination. It is a little alarming that our percent of total vaccinated is around 59%. I saw. I think the national average is not that much better. It's about 63%, something like that. So how are we with deploying those vans? We have some resources coming into the department, which could be utilized. But where are we now?
So we have ARPA dollars that have been that were allocated for this. Unfortunately, we only started to do sort of the requisitions and the background work to be able to get these vaccines within the last month. And it goes through a rigorous process of being able to identify, purchase. So we should have our first fully mobile, our first van that we have purchased by the summer. In the winter months, it's not as practical of a strategy, as you're aware, because having people in really extreme temperatures, it's hard to keep the temperatures up in those mobile vans for both the people that are working in them and the people utilizing them. So the goal is to have our mobile vaccine units available for the summer. We have one that we've already been using, so that'll bring it to 2. And then we are looking to get additional ARPA dollars to be able to increase our fleet. Because to me, this is the very definition of taking vaccines to people and meeting them where they are. And it will work for COVID and non-COVID initiatives, right? You're able to do a lot around screening and education from within those units for what we need to do. So I agree with you. I think mobile vaccine units are a great strategy. I have a relationship with DeKalb County in Atlanta, and speaking to them, they have a fleet of 10. They utilize them for vaccines, but then they're able to use them for a lot of non-COVID related priorities very successfully. So that would be the goal for me as well. And the mayor's office has been very supportive of being able to help us with additional ARPA dollars to make sure that we have what we need. The only issue here is, again, the bureaucracy around actually getting specs, orders, getting these things purchased. It takes a lot more time than one would actually anticipate. Linda?
Thanks, Dr. Maddie, for a great presentation. I'll be very quick. I was really interested in the relationship that you've established with Dr. Gang from Washington University and his data on hospitalizations. How are we making the most of that data? Are we sharing it with any community partners? what are the best ways that the department is looking at those hospitalization projections and either using them to inform the community and better anticipate our responses to any potential outbreaks?
Thanks for that, Linda. This is a very new partnership, so we only launched it. You're looking at the very first slides that we have. This is something that I've been really trying to push for because I believe modeling data really informs public health response. And so we've only had this data now using it for a week. So what I'd like to do is make sure that our epidemiology team are comfortable with this data. I've asked them to provide me with questions about additional models that he can provide for us. And once we have a robust slide set and comfort with this, I agree with you that this is something we'll be sharing. So similar modeling data is discussed at our pandemic task force meeting. So at least you can be reassured that the leaderships of a lot of the FQHCs, healthcare systems, and public health leaders in the region have access to this data, and that can inform their response. But I love that you are already thinking ahead, that this is something that we can help the community with as well. It's hard though, right? Because a lot of times, those of us with this level of health literacy, we may be able to understand how to use these curves, but sometimes if you are not really intentional about how to translate that in a way that doesn't confuse the public or have us accused, right, of making stuff up or oversimplifying in the way that we've seen over the last year, you know, the way the CDC's messaging and whenever they release data, the different interpretations of it. So I'm wary of just throwing new data at folks. I think it requires us to really sit down, my epi team, his epi team, and really speak about now what is the best way that we can use this for messaging. And I'm happy to work with you in the communications group on that if that's something of interest. But yes, this is just a very new partnership. You're looking at the first slides that we've gotten from them, and I'm really excited about how this will inform our approach. I'm gonna stop here. I'll be able to take questions at the end of when I come again for departmental meetings, because we have Franda Thomas and Dr. Echols today to do a presentation, and I know Franda has to leave right at the top of the hour and want to give them time to present and do questions. I will go back to our esteemed chair, Dr. Ballou, unless you'd like me to do just a brief presentation, a brief introduction as to what we're about to present.
Dr. Mayor, I think a presentation would be great. And I mean, a brief introduction would be great so we can orient the board to the importance of the next topic that our presenters will be addressing. So if you could give a little bit of a segue, that would be greatly appreciated.
Thank you so much. So we have.
Sorry to interrupt, but before we go on, would it be appropriate to introduce our new board members at this time?
Sure. I was going to wait till the board member report, but everybody is here. So we will take a pause, and after we introduce our new board members, Dr. Maddie, go ahead and make that transition. So a very, very warm welcome on not a warm day to our new board members. And I see we have Mr. Stephen Scott, who is the CEO of SLU Hospital, and thank you so much for serving on our board. We really look forward to working with you. And we have Dr. Colleen McNichols from Planned Parenthood. And thank you so much for working with us also. And we really look forward to your board contributions. Is there anything that you would like to say? I know it's your first board meeting.
I want to say thank you for allowing me to join the group. And I appreciated the conversation from Dr. Maddie, and looking forward to working with you all as well to improve the health of the citizens of St. Louis. So thank you.
Wonderful, thank you.
And I echo the same sentiment, happy to be here and excited to be able to contribute in whatever way I can.
Wonderful, thank you so much. All right, so let's keep it moving. And Dr. Mahdi, if you can give that intro and that segue to this important report we're about to hear.
Thank you so much. I want to echo our welcome to Dr. Scott and McNicholas. We are thrilled to have you and your level of expertise. I wish I could have video recordings of some of our reactions to hearing you were joining. We are incredibly grateful to have you. Your work speaks for itself and will help us greatly. So I am really thrilled to present. I want to be intentional about making sure we have non-COVID related presentations because there is so much really, really excellent work that the health department is doing and continuing to do despite this critical place that we're at with COVID. And so today you'll be hearing a presentation from Franda Thomas and Dr. Echols for our CARS St. Louis project narratives. The 4 pillars of community-based approaches to reducing STIs, or CARS St. Louis, are healing-centered engagement, regional collaboration, systems level impact, and a community advisory board, all to the end of ensuring that Black men are treated as whole and human. Such a beautiful and much needed initiatives. And so you'll be hearing here about what that initiative is, what they've been doing as the region aims to reduce the rate of sexually transmitted infections in Black men aged 18 to 29. So I'll turn it over to Franda now to get us started. Thank you.
All right, thank you everybody for their welcome. Good morning, my name is Franda Thomas, City of St. Louis Department of Health, Health Services Manager to Women, Children, Adolescent Health, and Communicable Disease. Dr. Echols and I will be just giving you guys an update on where we are as we enter into year 2 of our CARS project. As you already know, CARS project is a CDC funded initiative, and we can get into it. Dr. Echols, are you ready to share? There we go. All right. So just going to give a brief overview on the CARS project. Next slide. So CARS, CDC CARS grants. CARS stands for Community-Based Approaches to Reducing Sexually Transmitted Infections. The CARS program was established in 2011 by CDC to support the planning, implementation, evaluation of innovative projects that reduce STD disparities, promote sexual health, and advance community wellness. So in the middle of a pandemic, Dr. Echols thought it was a really good idea that we apply for this grant. And luckily we did, and we were funded. One of the things that was something that we did that we hadn't previously done before is that in anticipation for funding, we anchored all of our MOUs ahead of time. And so we actually met with partners that we wanted to work with throughout the region and said, okay, you know, can you enter into an MOU with us in the event we get funding for the CARS project so we can hit the ground running if by chance we were to get funded. That has helped us greatly. And we could talk about that a little more. This is just a one-pager, and it just breaks down what the CARS project is, like just a very brief overview of it. Next slide. So the CARS focused population is Black men in the city of St. Louis or a county who are between 18 and 29. So the purpose of the Community Advisory Board is to recommend policy change and establish regional interventions for the focused population. The Community Advisory Board consists of residents in the county who are at least 16 years old. Partners in overall community engagement is driven primarily by choices and decisions of the CAB. We were extremely intentional when recruiting for the CAB. We actually held interviews. We did community engagement, all social media platforms, just introducing the project, try to gauge interest so people could submit their interest to the community of joining the Community Advisory Board. What I should mention before is that once the city was funded, we entered into a contract with a subcontract with Williams and Associates. Williams and Associates is one of the oldest MSM focused community-based organizations in the city of St. Louis. And so their primary focus is men of color, MSM men of color, reaching those. And so we partnered with them to lead the drive of establishing the CAB and actually moving the CAB, recruiting the CAB and then moving the CAB along. So Dr. Echols is the project, the principal investigator, I'm the project director, and then Williams and Associates staff actually lead and drive the CAB. So again, as I stated before, we were very intentional about selection of the CAB because, as you all know, for a community advisory board to be most productive, it takes a lot of commitment. And they were able to, in those recruitment efforts, be very clear up front about what those expectations are, commitment, and what that would look like, and especially during the middle of a pandemic, because we were the first group of awardees in the pandemic. So just going into it, knowing that there were going to be some kind of challenges. Next slide. So this is just basically the implementation model. Next slide. I won't read that. So the Community Advisory Board, we have 6 confirmed CAB members, about 67% same gender living, 2/3 city residents, 1/3 county resident, more than half having endured sexual health challenges. Next slide. So one of the pillars that Dr. Mighty mentioned is that Black men must be treated as whole and human. Next slide. So here are the CAB strategic, could you go back 1 second, please? The CAB strategic direction and priorities. Again, everything that is done is voted on and created by the CAB, by the Community Advisory Board. Next. And that's just a quote from one of the CAB members. I'm excited about being a part of a group of people looking to change the narrative of health in St. Louis. Ultimately, my goal is for the health of African-American men become a normal conversation. I want to raise the awareness of Black men and help them realize there are resources out here for us to live long, prosperous lives. Next slide. So one of the pillars is education. Black men must be educated about their sexual health. So we have some commitments that we want to increase the number of sexual health support resources known by Black men by at least 3. The knowledge of how STIs transmit and manifest, and the healthy habits pertaining to maintenance, checkup, condom negotiation strategies. Some campaign interventions that they're interested in creating are comprehensive sexual education in high school, collegiate campaigns, and community campaigns. The policy and advocate lanes, advocate for high school students to have access and opt-in sexual education courses, and advocate for campuses to host 2 events dedicated to sexual health per semester. Mental health. Again, Black men must be healed as whole. In order to have strong and positive sexual encounters, the CAB wanted to make sure that they fully understand our whole selves, believing in healing mentally, emotionally, and spiritually. So those commitments look like increasing the number of sexual health support resources known by Black men, develop programs for men who identify with sex addiction, victims of abuse, or more susceptible to STIs. And Black men have access to one person/group and comfortable knowing about sexual health. Some of those campaign interventions develop spaces for support groups by Black men, and also recruit mental health workers in those spaces. And then also advocating the policy that allows for an increase in affordable and accessible resources spread throughout the community. Next slide. The holistic health. Traditionally, men struggle to adhere to healthcare practices. They thought it was very important to invest in Black men and their sexual health as well as the overall well-being. So those commitments look like increasing the number of sexual health support resources known, increase and promote culture of sexual health responsibility and engagement, increase contact with medical professionals, ensure that Black men are receiving regularly quarterly sexual health testing. Some of those campaign interventions that they hope to achieve are mobile app for test results, billboard campaigns, pamphlets, men's health lecture series with doctors and men of various health fields, as well as sexual and mental health testing programs. And with the policy advocacy lens, accessible spaces in each neighborhood to get tested, and high school readiness health checklists for juniors and seniors. Next slide. So mention the partners engagement going into it before we got funded. So we secured partnerships from Affinia, Missouri Department of Health, St. Louis County Department of Health, St. Louis Regional Health Commission, St. Louis STI HIV Prevention Training Center, St. Louis STI Regional Response Coalition, Project ART, Washington University Race and Opportunity Lab, as well as Missouri Family Health Council, Missouri Institute for Mental Health, Urban League, and Man Up STL. So we have partner org groups in which those stakeholders that we just mentioned before, quarterly full meetings, and also one-on-ones. The purpose of those meetings is to share updates, talk about any kind of CAP support needed, and then have those collaborative deep dives and making sure that all the priorities are in alignment. Next slide. And so most recently, we completed a culturally responsive support series. The facilitators were Dr. Vetta Thompson and Dr. Carla Scott. It took place through through the months of June and October. And so it went out to all of our partners. partners and or providers who work with Black men in St. Louis City or County. And it was well attended. It was several different cohorts. Some were for providers and some were for people who work with the community. And so basically it was cultural competency, humility trainings focused on racial healing, intercultural communications, implicit bias, and cultural sensitivity. It was the feedback that we received that it was very powerful, so much so that actually the state of Missouri reached out afterward and wanted to provide this to their staff. And so kind of working the king side on that. And so hopefully that comes to fruition. Next slide, please. And that's just the flyer that went out that was advertising the series. Next slide. So I'll pause right here and actually hand it over to Dr. Echols to talk about some of the current things in year 2. Dr. Echols.
Good morning, everyone. So one of the things that we wanted to do is continue to evaluate the implementation of the program as we move forward. So one of the things that the CAP has done is look back on year 1. We're now in year 2. So we'll look back at year 1 to see how effective the partnerships were. And so we're looking to bring on new partners, again, partners who engage with African-American men who can provide assistance with engaging them on issues related to health. Recently, we also had an opportunity to meet with national experts who've been in the field, particularly those who are MSM, who considered to be MSM leaders. And so we were able to present information on year 1 of the project. The topics that were presented were learning and leading, becoming advocates for Black men's health. And so this was actually led by the CAB members. During this session, the CAB members actually talked about their experience participating in the project and how their perception has changed as it relates to advocating for Black men's health in the St. Louis region. This information was well received by all of the attendees, which included representatives from really across the U.S. who again operate in this space. The second project that was presented was Black Men Are Whole and Human, and they really gave an overview of the project from the administrative perspective. So myself, as well as Darius Rucker, who serves as the project lead, as well as the co-chair for the community advisory board, really presented on what it looked like from a planning perspective. And this information was particularly geared towards those individuals who work for local health departments, as well as those who work at community-based organizations, aid service organizations who engage with Black men around sexual health related issues. And then finally, there was a poster presentation that was provided by Dr. Preeti Palluri on creating regional culturally responsive services experience. And this was an evaluation project that was done on the project that Friend Thomas mentioned, where we focused on providing culturally sensitivity training to individuals who operate in this space. The information was also well received, and we can share the poster presentation as well as the abstracts that were presented to the board. Another thing that we did was after year 1 was we compiled a report. So CDC had their own template for reporting, which included just some basic metrics that they wanted to obtain from the health department on the project. But the CAB actually took it a step further. And so they actually a full report that we can share with the board as well. So we'll send those documents to Kimberly Vandenberg to send to the board. That concludes the presentation. So at this point, we will open it up to any questions that the board may have.
Thank you for the presentation. Any questions or any?
Yeah, thanks, friend, Dr. Echols. In terms of actually getting penetration, I shouldn't use that word, getting broader exposure to the African-American community about sexual transmitted infection, I was alarmed several years ago when I found out there are very few schools actively engaged in sexual education, high schools. I hope things have improved. I mean, this was like 5 years ago. I hope things have improved, but frankly, I see a great need of just staying upstream and really getting that broad education sustained, those efforts sustained within our high schools. What is the status of sex ed in high schools? What are some of the barriers and are there successes?
So there are several barriers. One barrier being lack of capacity within the school. So oftentimes the school has the physical education teachers responsible for implementing sexual health education along with a slew of other activities. And the politicization of sexual health. That's also a huge barrier that has created challenges for school administrators to actually implement evidence-informed sexual health education. A few years ago, there was funding that was received by the National Association for County and City Health Officials for this very issue. So we secured funding, and the intent of the funding was to support schools in the development of sexual health curriculum for their districts. And so at the time I was with St. Louis County, so I did a road show essentially and visited each of the superintendents in the city in St. Louis County to talk about sexual health and sexual health education for their district. At the time, there was very little interest in sexual health. And this was from the administrative level. In addition to that, they were concerned about the perception that parents would have about having evidence-informed sexual health provided to students. However, we were able to work with one school, which is Normandy Schools Collaborative. Dr. Pearson was a champion for sexual health, and so we actually worked with them over a course of about 3 to 5 months, helping them plan and develop a curriculum that was implemented after the completion of the project. So it's still a major issue. Working upstream is definitely something that we aim to do, but we have to make sure that the boards of education and the school district administrators are also on board, because they'll be the ones that would be responsible for championing it amongst their population.
I have two questions. I noticed that there was a partnership with the Missouri Institute for Mental Health, but I didn't see very many other specifically focused on mental health partners. Can you talk a little bit more about MIMH's role in this particular project? And then my second question is, what type of communications partnerships do we have? Because a lot of this is around messaging. So are we doing all of this in-house, or do we have external partners that are also helping with the communications component?
Sure. So Williams and Associates have been the lead on I'll start with your second question. So the messaging, so they've been working with their partners on the messaging, because they want to make sure it's tailored for the specific population. But it is something that we're looking at, because the intent of the project is for Black men, right? And so we want to make sure that we have other partners who can help elevate that message and tailor the message so they can reach a wider audience. So that's something that the CAP members, myself and Darius Rucker, we're having discussions about, because we want to make sure that we're reaching a wider audience. For your first question, the Missouri Institute for Mental Health, so far they've signed up as a partner. They've played a limited role. So one of the things we look at year 2 and year 3 and really focusing more on having more materials on mental health and engaging Black men around those issues and informing them about the resources that are available across the St. Louis region. That's something that we're aiming to do as well. But again, we want to make sure the messaging is right. So the communication piece will be important there, as well as making sure that any resources or materials that are created are reviewed and approved by the Missouri Institute for Mental Health.
And Serena, that's a really good question as well, because as like Dr. Echols said, as we're entering year 2, one piece of that is, at those partner org meetings, we sit and have those conversations about who else needs to be at the table. So it's definitely not, those are a final list of partners. We are always actively engaging and recruiting for others to sit at the table, either as a part of the community advisory board, if appropriate, or just as a partner org. So we definitely welcome any kind of other referrals that you guys maybe think we should look into. Again, because it's fluid, and year 2 allows us kind of looking back and saying, okay, now that we have a firm CAB established, what does this look like? And just kind of aligning priorities. And when you guys look at the annual report, you'll see some of the things that we were able to identify and some of the things that we thought were important. And then, of course, not only through the pandemic, but being actually present to do the work, have to pivot and change. So thank you for that.
Thanks.
Thank you. And I already see a message in the chat that Dr. Nicholas, our new board member, is interested in partnering. So hopefully,
I was just actually responding to it because I spoke with April Jolly Tuesday in great length, and so she was so excited. She actually reached out to Dr. Money and was like, "I want to hear about cars," and we spoke for about an hour. And so we're excited about having Planned Parenthood become a partner org for this project.
Yeah, I cannot say how excited we are. So that meeting I spoke about earlier, a lot of different areas of collaboration came up, but it was just so exciting to see Colleen and April really step up to the plate and show such an interest in cars, because some of the questions that have been brought up speak to that, right? Dr. Echols has this longstanding experience with the politicization, as he spoke to. This is a big problem, and Planned Parenthood brought it to my attention at the meeting. So we're trying to do something, and Washington University, the Brown School, has actually come to me about this as well. And so I think there's an opportunity here for positive pressure, because ultimately when we allow this type of education to be politicized, it hurts our children. And as has been presented here, disproportionately children and of color and here Black men. So really, really excited for that partnership. Thank you, for Colleen and April Jolly for that. Dr. McBride?
Yeah, yeah, thanks for an excellent presentation and important initiative. I think you may have just alluded to what I was going to mention, Dr. Mahdi, which was you're probably aware of the initiative that Sean Joe's working on at the Brown School through Homegrown St. Louis, and he reached out to me and our team. And I put some things in the chat about how the whole state is lagging in terms of Medicaid expansion. And one of the lowest rates of expansion numbers relative to the projected numbers we thought would enroll is in St. Louis City. We're pretty much down towards the bottom in the state. And so, Dr. Joe and I have talked about, he brought it up that African-American men have historically never been eligible for Medicaid for categorical reasons. And so they may not think of Medicaid as a place to go, but under the new Medicaid expansion, they're eligible if they're under 138% of poverty, period. And, that message needs to get out. And we've identified that maybe 10,000 African-American men are eligible for Medicaid expansion in the city and the county. And we certainly need to get that message out. And he's got some flyers and other initiatives going on in that. That's obviously, expansion's not the be all end all, but it certainly will help reduce costs and all that.
Thank you, Dr. McBride. Any other comments or questions? And thank you for your work in this area and this presentation, because these issues are still continuing along with COVID, and we can't let these STIs and other men's health issues get out of control while we're dealing with COVID. So thank you for your work in this area. Any other comments or questions? Rhonda, I know you have to scoot off to another meeting. All right. Thank you so much. Let's move on to board committee reports. So do we have any reports from the governance committee and the governance and nominations committee?
Good morning. This is Linda Racklin, Chair now of the Governance and Nominations Committee. We did not have a meeting between December and January, but first and foremost, I believe this is the last official meeting that Dr. Ballou will be chairing. And so we know that she is relocating to a different professional position in another city, and that in the interim, Dr. McBride, in his role as vice chair, will be taking over for a short period until we have our new chair, Serena Mohammed, who will be stepping into the chair role, if I have all that correct. So I just wanted to have us all extend a word of thanks and appreciation to Dr. Ballou for her terms of service, And will you still be joining us as a board member during the remainder of this year, Dr. Ballou?
I'd have to check the legalities of that. I'd certainly be.
Okay. Well, we'll be
allowed.
in touch. Well,
Yes,
we'll
it's
be in
allowed.
touch.
I still have ongoing collaborations with the city and folks in St. Louis, and we'll continue to do so. So we will, if you can have me without getting in trouble, I am happy.
Yeah, I can assure you that will not be a problem. We may have to take a vote. I'll double check on that at our February meeting.
Thank you, Dr. Ballou.
Yes.
Thank you.
Hear, hear.
Thank you. It's been my pleasure.
Yeah. And as we all we've already welcomed our new board members and thrilled to see them. So this year our committee will be working hard to think about filling new board positions. We do have 6 board members whose terms will be up in 2023. We will have to take a careful look at how many of those board members are eligible to renew their terms. We do have, we serve 4-year term limits with two terms permitted for each board member. So our committee will be taking a close look at that and working on recruitment for new board members in the upcoming year. We'll also be working with Dr. Mahdi to help with some onboarding and orientation of our new board members. So that's what we have on deck. And we'll look forward to having Dr. McBride chair our February meeting. That's it for governance and nominations, unless there are any questions.
I don't see any hands raised. All right, thank you for the report. Much appreciated. Do we have a report from the Academic Public Health Collaboration Committee? Craig, are you on?
I am. Can you see me?
Yes, we can.
Great. So good morning. The one aspect of the collaboration is with the Academic Health Department. That aspect of it has been St. Louis University and St. Louis County Department of Public Health and the City of St. Louis Department of Health. There has been funding from the Missouri Foundation for Health as we create that infrastructure for an academic health department. There are many changes happening. The funding for that is scheduled to end at the end of this month. There's been a request for a no-cost extension to allow for some heavy lifting that would be part of both the City of St. Louis's needs with regard to their workforce development and St. Louis County Department of Public Health's workforce development. So the hope is that that will become part of our work going forward into the next few months if we're able to get that no-cost extension. City of St. Louis, of course, is working not only for being supportive of the workforce, but also for accreditation, which is coming up in the first quarter of 2023 for the city and the third quarter for the St. Louis County Department of Public Health. Other changes occurring, so the PI of that project, one of the PIs, because they have indicated that they're sharing that even though officially it's one PI, is Dr. Pam Exavarius. She's becoming the Vice President of Research and Scholarly Activity at the University of Health Sciences and Pharmacy. For most of us, we know that it's a College of Pharmacy with a great reputation here in the city of St. Louis. Also, Spring Schmidt has moved from St. Louis County Department of Public Health and is spending 25% of her time in the Office of Public Health Practice at St. Louis University, as well as her new responsibilities with Missouri Center for Public Health Excellence. So a lot of moving parts with regard to that, all very good things in terms of what we're doing moving forward. And there are some surveys that are out for our staff and the staff over at St. Louis County and at SLU to see how folks are seeing their participation in this effort. That's the extent of my report this morning. Thank you so much.
Thank you. Do we have any questions, any comments about our our health department and local academic relationships?
Yeah, Dr. Ballou, I did want to say one of the reasons I pointed out Spring Schmidt is that she has been part of the academic health department, and she is very much a proponent and advocate of this, and may have a big part in that across the state in her new role.
Yes, so she is now on the Office of Public Health Practice at SLU. So, and I think SLU is kind of working on how to really build up that office and to establish relationships. So I believe she started January 1, so we should have some more information and to see where what relationships are built going forward. So our next report, I will call on Lisa. Lisa, do we have any reports from the Health Communications Committee? I know you've been busy.
Yes, good morning, Lisa Richter, head of the Board Communications Committee. We still have our community survey open through the end of this week. We have nearly 800 responses. We do not have an equal balance north and south, but we do have a statistically significant amount of response from wards or zip codes collectively north and south. So we feel good about the data. We did make an effort to, do outreach and with the aldermen to get additional responses. Hopefully we can report a few of the results at the next board meeting. But one thing that will be real important is to brainstorm with staff and board members and community partners ways to put into action the priorities that the public has given us in terms of health on the survey. So it's important because there was some visibility of this to get back to the community and tell them, okay, well, what are we doing or continuing to do in the areas that people consider most important? And Dr. Ballou and I had a conversation a couple of weeks ago about next steps, and that was really important from her perspective as a public health practitioner. And also, we know one of the characteristics of our region is that we have a lot of people working in a lot of groups on a lot of the same problems, challenges, issues. And so collaboration, as we talked about with the CARS program, will be, probably in those action recommendations off the survey as to next steps. We want to be as efficient and join forces with people who are knowledgeable and have been working on some of the issues that the public, considers most important. It will also be a platform for news for the Department of Health, I believe. I mean, we could probably get some news stories out of this, but I don't want to share the results until we finish tabulating after the end of this week. Are there any questions? Thank you.
Thank you, Lisa. And if everybody can brainstorm, Lisa and I did have a conversation about it, about how to really get the messaging about what the health department is doing and what services people perceive the health department is providing and kind of the value proposition, and really get that information out to the public and to get the public's opinion about that and to make sure that they know that the good that the health department is doing. It's just important messaging, given that a lot of the messaging is COVID vaccines and COVID testing, which is obviously critically important, but I think it's still important to kind of get that messaging out in terms of all of the other activities that the health department is doing, like the CARS project and other things. So just making sure that the Health Communications Committee is supported and we're getting the news out about the health department strategically, and that the information flow comes from the health department to the community and vice versa is really important. So there are no more questions, we will go and move to our next agenda item, which is our departmental updates with Dr. Mahdi.
Thanks, everyone. I'm going to try to do things a little bit differently based on feedback. Really appreciate Dr. Ballou always pushing us to be better. And her and I had a really, I found, helpful conversation about the role of the Board of Health with the Department of Health and how to better utilize that. And so we'll be challenging everyone on this board. You know, I want to embarrass a little bit Dr. Luis, who after last board meeting felt very strongly about talking to me about what are we doing around substance abuse and intervention strategies, and took the initiative to not only, he followed up after the meeting, reached out to me, we set up a meeting, talked a lot about some great initiatives and what some next steps will be in helping this for the city and the region. And so I think that we need to be a lot more assertive about, you know, the board reaching out and making sure that we're getting ideas, we're getting collaborations. Dr. Ross does this around the clock with us in different aspects, but certainly here as well. And, you know, with new board members, I thought it'd be really great to just say that that's something we welcome. You know, if there's not enough time here, please text me, call me, email me, and set up meetings so that we can have accountability and really move forward some collaborative work. So from a departmental update, I want to just remind you where we are as far as priorities, right? We're in the middle of a critical surge, unprecedented national, regional, city. So COVID, unfortunately, continues to take center stage. What are the priorities there? Vaccinating and boosting people, but with a lens of equity. So I told you about the fact that we now have pediatric vaccines. The goal here is to partner this with education initiatives to make sure that folks are more comfortable with knowing why this is so critically important, and then taking vaccines to people, using trusted messengers, trusted resources. Our pediatric work group is still meeting, always providing feedback. Our partners are doing a phenomenal job getting vaccines to folks' arms, and our DOH-sponsored clinics are still putting in really high numbers of vaccines, but there's more work to do. So we'll be working with our pediatric vaccine work group to be able to increase presence here, especially in the North City, and especially to address that disparity in young children, seeing that, you know, Black and brown children are not being vaccinated at the same rates as other folks. For non-COVID initiatives, that'll be the bulk of what I'm speaking about here in my departmental updates. So I'll just dive into that right now. So for our upcoming pediatric vaccination clinics, we have a soft launch on January 22nd. The first official clinic is on January 29th at the LaSalle Center from 11 a.m. to 3 p.m. Please, please, if you aren't already, follow us on Twitter, Instagram, and Facebook, and retweet, reshare, get the news out. Kim and Harold do a phenomenal job of every week making sure that there are easy infographics on where people can get tested, where people can get vaccinated. So you'll be seeing that pediatric vaccine clinic. Expansion of the vaccine incentive program is going to be forthcoming in February. Previously, only first doses were eligible for a gift card, but now we have second dose and booster administration for city residents to get a gift card. This is important. There's a lot of really inaccurate information about people assuming that we're paying people to get the vaccine and that is coercive. It couldn't be anywhere different. The health department is very intentional about the fact that those incentives are available after you come in and get counseling and get a vaccine. But that it's important, right? We know that there are barriers that exist for folks even getting to a vaccination clinic, let alone in their day-to-day lives. So being able to provide them with the support that they've always deserved is, I think, an important part of this, and has been very, very well received. And folks have been asking for it to be expanded for a while. So we're very excited that we're able to do so. We've been filling vacancies, and much credit to Dr. Echols, who's been working very closely with the Department of Personnel. And we've been filling vacancies in our animal control, which, if you remember when I first took over, was just flailing, and we've had multiple vacancies filled there. And we are looking, and a secretary one as well. So still looking to fill in all of our departments, but trying to be as proactive as possible. But this has to start from the top down. And as you've heard me say, I speak very closely with the mayor's office about what we're doing to make sure that we have equitable salaries and to streamline the sort of process to get folks in, because previously it would take up to 6 months to get someone in from the time that we hired. And so the Department of Personnel has been working with us closely to try to decrease that time, and we're seeing that yield really great results. So just grateful that our proactive sort of spirit and leadership here has helped us try to get more folks in. Our community sanitation and food beverage inspectors are modifying inspection strategies to help minimize COVID-19 risk during routine inspections. Complaint and critical violation procedures remain the same. But the challenge continues to be strain on staff due to increased workload and loss of historical knowledge when we have this constant staff turnover. So really working on our value incentives within the department, on making sure that people are gaining value in other ways, professional development opportunities, and then, like I said, advocating at higher levels to make sure that this is increased across the board for city employees. So for our communicable disease and women, children, and adolescent health, you've got this amazing presentation from Franda and Dr. Echols around CARS. Very proud that they have had presentations in multiple conferences. So the NASM conference, which stands for National African American MSM Leadership Conference on Health Disparities and Social Justice. And we had 3 presentations there: learning and leading, becoming advocates for Black men's health, Black men are whole and human, practicing healing-centered engagement with the Community Advisory Board. And lastly, creating a regional culturally responsive services experience. And that was a poster. The Fast Track City, St. Louis, has their first meeting coming up on January 27th, and will be welcoming Suzanne Alexander to the core group as its newest member, which is very exciting. Women, children, and adolescent health has to be one of the most hardworking sections that we have. There are so many updates that I don't have time to bring them all up. So many thanks to Candace, who's on this call, De Silva. I'm hoping to have her and her team do a presentation for our next board meeting to really just champion all of the great work that they're doing. But some highlights of what they've been up to. So the first Momnibus Steering Committee meeting of 2022 is January 21st. The resiliency booklet has been cleared for distribution, and we'll share that in the link in the chat right now for you to be able to access. A Qualtrics survey and informational flyer with QR codes have been drafted. The goal of the survey is to learn how COVID-19 has impacted women's ability to access quality healthcare services. I think that's such an important survey for us to hear from women themselves. What have the barriers been and how can we help address them? And then the Men Health series on stress management will air this month, a critically important topic because stress management is as you know, such a big part of our mental health initiative. There's a lot of going on around Nurse Gwen following up on child fatality visits. They're refining their OBGYN partner list to engage stakeholders. The Lead Safe St. Louis team is compiling data for the HUD quarterly report. So a lot of good work is going on here. And again, we have Nurse Yvonne who works tirelessly with SLPS lead clinics as well. From the disease investigation standpoint, we have updated guidance for schools and city residents now on the website. So we have been working tirelessly to make sure that we have updated policies that are forward-facing for the public: isolation and quarantine, test to stay and test to return for schools, masking guidelines for COVID-19 in order of preference and efficacy so that folks know which masks are the best for them, and ventilation guidelines. We're also sending out all of some best practices to businesses and have compiled a comprehensive listserv of businesses as well. So really doing a lot of great work there. For HIV prevention, the EHE Take Me Home program has tripled in kits since inception. So they're currently reaching best practices for the PrEP hotline. Our Health Stop closed the year providing service to 427 individuals, a phenomenal feat. Currently open for appointments on Monday through Thursday to provide testing for HIV. Black AIDS Awareness Day is February 7th. Events are going virtual due to the increase in COVID-19 cases, so be looking for that. Our TB and refugee clinic conducted 60 medical screenings to refugees in December. That's such a great service to be able to provide. TB is, as Frandes puts it, feast or famine. And she says we're unfortunately feasting right now with over 9 active TB cases. These are really complex cases. I sat in on one of the reports last week, and I'm talking about, it took me back to my infectious diseases days, some of the most difficult cases that you would see on the floor. So incredible work happening for our clinical arm here at the health department. I will stop there and take any questions or comments.
Thank you, Dr. Mahdi. And just a reminder, there are a lot of folks on the call that work with students at that may potentially need employment. So make sure we get those job descriptions so we can help send potential candidates your way and send them through the system. Any other comments or questions about the department updates from the board?
One comment is it would be great to have some of this summarized in a document after the meeting. I know that we get the presentations, but as we are thinking about how we can be supportive, just having a summary of highlights of what's happening, not just verbally, but a document, I think would help us connect between meetings to work that we might be able to assist with.
I love that idea, and I can help facilitate that because I make a document for myself, so I can make that document available. So thank you, Serena. I think that's a phenomenal idea. And if it will help with engagement, I'll make sure that my contact information is on that document too, and welcome, meetings, all of that. It's been great engaging with the folks that have felt strongly about certain topics, and it's helped us be better.
All right, thank you for the updates. Do we have any old business? All right, no old business. So announcements, one announcement is our next meeting will be February 17th. Again, the third Thursday, same time, same place, 8 a.m. via Zoom. Do we have any other announcements? Any good news, any announcements or anything? All right, right on time, 9:30. We'll move that we adjourn our meeting. Or can somebody move that we adjourn the meeting?
So
Move adjournment.
All right, and I heard a second. So all in favor?
Aye.
Aye.
All right.
Thank you again, Dr. Ballou.
Thank you all.
Yeah, thank you.
All right.
Again, Rhonda.
Thank you. February 17th, same time, same place. Everybody stay healthy and stay safe. Bye-bye.